I love my job. It's a fantastic job. I get to talk about something that I'm very passionate about, which is immunisation. So I do run an influenza vaccine program to a lot of medically at-risk kids. But before I do that, I usually do surveillance on all the new kids that come into the hospital. So, and I alert on our system called Oasis. So I let the medical teams know if their child that they're looking after is not currently up to date or needs to be reviewed, then I would put that on there, and I would hope to catch up with the parents and hope to catch up with the child as well, to either provide their vaccination or to update their ACER records as well. I also do all the stem cell and post-chemotherapy oncology children as well, so they're revaccination programs. A lot of people don't realise that after chemotherapy and stem cell transplant, that these children, these cancer children, need to be re-immunised, and sometimes they can be up to like 15 to 20 injections that they do have to have over an extended period of time. So I get to see those quite often, and I get into the lift sometimes without my trolley, and they start crying, and I have to say I haven't got anything on me. But I also look at doing the opportunistic vaccinations throughout the hospital. So that's looking at the paediatric side of things. So going to ward and trying to update the ACER with that. But looking at influenza and the paediatric side. So this is what I've been doing the past few years. And this year I was able to really focus on this because previous years I've been doing a staff vaccination program for the influenza, and this year and a little bit of last year as well I was able to focus on this. So basically with the respiratory patients, I mainly see the cystic fibrosis children, and I usually go down there every Monday morning when they have a clinic, and I station myself down there and see them every week when they do come in, and it's a perfect opportunity to grab these children. And the consultants there are also fantastic in referring them onto me as well. The oncology children as well, I also see in my clinic, and as part of their routine revaccination program as well, offering the influenza vaccine. Metabolic and immunodeficiency and cardiac, I also do the heart kids, so I'm partnered up with the heart kids clinics that they run up there on the 6th floor, and provide influenza vaccination to those kids as well as information to the parents to let them know that it's probably a good idea that they go and get done as well. So I'm just going to talk a little bit about the guidelines. Australian Immunisation Handbook, so 10th edition 2013 when it came out, basically says that pregnant women and women planning pregnancy are recommended to be immunised against influenza because they are at increased risk of morbidity and mortality from influenza. Also recommended that all pregnant women should be immunised as early as possible. So they're pretty good guidelines to say that, okay, we need to look at doing our pregnant women as well. And that was backed up also by the Royal Australian and New Zealand College of Obstetricians and Gynaecologists. Best way to protect pregnant women against flu is by vaccinating against it. That's pretty easy to read, isn't it? And it makes complete sense. The influenza vaccine is safe for pregnant women in all trimesters, with no unusual patterns in pregnancy or fetal outcomes being observed in vaccine adverse event reports. So we're looking at that, and then we need to put that into actual practice, don't we? So I'd like to tell you that from previous years, from 2013 to now, our rates have gone up to 92%, better than last year for vaccinating pregnant women. Now that might sound good, but it's not really. Because previous years I never ran a program over there. So, figures, you can make that sound really good, but unfortunately, because I didn't run a program last year, it was difficult to get into this year as well. So, these are the figures that we've got at the moment. So for all the vaccinations that I've done in the women's outpatients, so that's when the women usually come to our hospital, and that they're seen in the women's outpatients either by a midwife or an obstetrician, and basically for a first checkup and consecutive checkups as well. So our figures are from this year is around the 188 mark, and consultations, usually do around about 100 consultations, and what that involves is talking to the new mums to be, as well as their partners as well, and just telling them about the influenza vaccination and what it involves and why it's a benefit. And there's lots of brochures and so forth to go along with it that we make available to these people as well. So to set it up in the hospital, it wasn't that difficult. Basically, what we needed to do was get access to a room, and that I thought was going to be my first hurdle. And then there's responses. Like there's going to be responses from clients, so the mums, and also the partners and anyone else that's involved in coming, like the mother-in-law or the mother of the lady that's going to have a baby. Staff, and that could be the obstetricians, that could be midwives, and others as well, which I'll talk about after. So responses from clients. Now they can be mixed, and it can be very difficult sometimes because they're quite mixed emotions and so forth. Some of these mums can be mums that have gone through IVF like 4 or 5 times, and that they're thinking, I want to try and do everything best for this baby that I'm so blessed to be having, but I don't think I really want to have an injection that might do some damage to this baby. So it's very difficult to talk to these mums, but we do provide the best evidence, and we provide a service that we're able to talk to them through. But again, it's going to be their decision, and we provide the information, and they can always go off and look it up, as well as come back to see me, which a lot of them do. Consecutive visits, they usually ask for me, and or the Virtue team, which they've also gone and done some research there too. So responses can be quite difficult to work through, and but it's always a challenge, and I'm really always up for a challenge. Staff. I thought this staff thing was going to be very, very difficult. I'm not sure how many midwives are out there. There are a few midwives out there. I think there might be. I've not had much experience with midwives before, and some can be quite challenging. As you can gather, I'm not a midwife. But they were fantastic. Honestly, it was like they couldn't do enough for me. They gave me a room that I could house my little trolley in, and they allowed me to use their reception staff to hand out my brochures, and allowed me to spruik in their waiting room as well. And they wanted posters, which I didn't really have. But they were so accommodating, and it was so fantastic, and that was one less battle that I had to contend with. You might be wondering what all these pictures are about, but when I was able to talk to the families about this, a lot of the husbands or the partners, they would say, what about me? You know, I really want to protect this baby as well when it does come out. Can I have a vaccine? Well, and they say, what if I pretend I'm pregnant? Which is what this fella's like. But you know, I was able to talk to the family as well, so I was able to direct them to where they could get it cheaply, or where they're able to access it, and I think that was really important. So a lot of the consultations was with the partners as well as other family members like the mothers-in-law and so forth. So it was comforting to know that they were interested in having this vaccine as well, to provide protection for their baby as well as other babies that are around the place. So, influenza vaccination during pregnancy and women planning pregnancy as well. Now, how can the service be improved? Well, this is a poster from Queensland. It's a fantastic poster, I think. I would love to get it down here. But I think to begin with, Maureen commented earlier about 80% of pregnant women would take up the DTPA if they were recommended to have it. I think this is also important and vitally important with the influenza vaccine as well, because if they were told they should have it by the obstetrician or their midwife, I'm pretty well guaranteed that 80%, 90% maybe would be taking it up, and probably taking it up in the hospital or with you guys out in the community. I think that's a really important message that we need to get across to obstetricians as well as midwives. I currently do, I teach in third year University of South Australia in the midwifery, so I teach about immunisations there, and I always talk about pertussis and I always talk about influenza, and a lot of them don't really know much about it to begin with, so it's really, really important that we do get this message out that it is safe and it's recommended that we can give to women as well. So how else can this be improved? I think maybe a bit of media coverage. So those big sponsors could come and give us some media coverage. So television campaigns and so forth, and radio campaigns, even in like waiting rooms in doctor surgeries and so forth. So I think it'd be really important to try and get this message across that we can get those rates a little bit higher than what they currently are. So next year I hope to get in nice and early and again get some really good results in vaccinating these women in the women's outpatients. And this is one of my favourite pictures. Although it's a little bit low, it's not even really in the deltoid, is it? Okay, thank you very much.
A couple of questions. So you run an influenza program in the antenatal clinic. In 2014 you had about 100 and something women so far who've had the vaccine. How many do you reckon, in terms of proportions or percentages, decline to have it?
Yeah, great question. I didn't actually count, but I reckon probably around about 30 to 40%.
Okay. Can I have another one?
And if I comment a little bit further on that, a lot of them are non-English speaking background. And okay, but a lot also do have interpreters with them.
Yeah.
And some aren't the medically approved interpreters. So how far that what I say to them gets through is could be.
Yeah, I think that's really interesting. Talking to women from different backgrounds who don't speak English or English is not their first language, and how much are they missing out as well. And my final question was about when you're talking to women and their families about getting an influenza vaccine, do they talk to you about whether they've had the discussion with their healthcare provider, with their obstetrician or midwife or GP?
Yeah, a few do, and a few say it was never brought up, so I'm not going to think about doing it. And then I'll give them a brochure that's, SA Health. It's recommended. So they say, oh, well, it must be, so let's go ahead and do it. But yeah, I think, as Maureen commented before, I think if it was recommended and it was suggested and it was talked through, I think they would really take it up a lot more than what they currently do.
Hi, my name's Cheryl. I work as a midwife doing antenatal care, and I'm an immunisation provider as well. First, I just had a question, is that when you're offering the influenza immunisation, if the pregnancy crosses years, do you do it now and then do it again in the new season?
Sure. So again, with the vaccination and with the handbook, it does say seasonal. So it depends when. So if they come into the antenatal class, or if they come into women's outpatients, and it's like November, December, January, we won't be doing it because we won't be doing it until probably the March when we start getting the vaccines through. A lot of our vaccines expire in November.
So
forth.
Early pregnancy towards the end of the year, you'd leave them until the...
Yeah, because our vaccine usually expires in November anyway, so we won't have any vaccines for December or January, February.
And just as a comment, I think if it becomes part of the perinatal practice guidelines, and if it was actually in the Orange Book as something that you ticked off, women look at that and expect that that's normal standard care. So if there was a blank spot in the Orange Book, they'd go, well, how come I'm not having that?
Yeah, excellent.
Could I ask somebody else to ask this? As you know, we do a healthcare work vaccination. We get a number of pregnant nurses who we advise to have the flu vaccine, and they're often reluctant, even though we give them the information. We usually say to them, talk to your obstetrician or your midwife or your GP who is looking after you And sometimes we get told that, oh, my midwife or my GP's told me not to have it, or my obstetrician. Can we say, look, can you ring the Women's and Children's and speak to me?
You can do that. I don't mind talking to them. I get lots of calls about that. But you could also direct them to the handbook as well.
We do.
Um,
we do.
Yeah.
When you've got a midwife or a GP, or as I said, even an obstetrician say, oh no, don't have your flu vaccine.
Yeah. Yeah.
We need another avenue.
The immunisation section, SA Health, they've got a 1-800 number that you can contact if there's any queries or if they'd like any further information on influenza during pregnancy.